Welcome to Surviving Medicine, where we uncover the hidden dangers of modern treatments, the ones doctors never warn you about. I had no idea what glucocorticoids were until a short, high-dose course shattered my health. Prescribed with no real warning, the drug broke my body down in ways I never thought possible, and yet I was told it's not the drug. Many call steroids a deal with the devil, a quick fix that can cause lasting destruction. In the Steroid Diaries, we expose the truth through real stories from those left to suffer in silence. In our first episode, I sit down with Villeinia, who was given steroids for hair loss, only to watch her body rapidly deteriorate. Like so many of us, she was dismissed by doctors and left searching for answers. This channel exists because these stories need to be told. You're not alone. Welcome to the Steroid Diaries. Villiina, welcome. Welcome to episode 1 of the Steroid Diaries. How are you?
Thank you. I'm good. How are you?
Yeah, it's great to have you here. So look, before we get into your experience with steroids, I wanted to start with a bit about who you were before all of this happened. So could you just tell us a little bit about your life, maybe your work, hobbies, or just how you saw yourself?
Yeah. Well, to begin with, I was actually very healthy, which looking back seems like ridiculous. I was even prescribed such a medication that carries like such a high risk of causing life-altering side effects. I had a good career. I was very active in hobbies, dancing mainly. I took dance classes every day for 3 to 4 hours per week. I was social and outgoing. So my friends often for coffees and lunches and went for walks and movies, parties with them. Just very, very normal life. Kind of seems like innocently carefree now.
Yeah, it really does sound like a good, active life. So looking back, how would you describe yourself, maybe just physically and mentally before starting glucocorticoid steroids?
Well, I was quite fit. I was slim. I liked my appearance. I was rather young looking and in great hormonal health. I had some anxiety about, or I had anxiety about hair loss, which was the reason I turned to the dermatologist who prescribed me steroids eventually. But other than that, I was healthy, no physical illnesses, no pains, no medications. I didn't see doctors very often, once or twice a year, an infection or whatever, like something passing. No chronic illnesses, nothing.
Yeah, so not much kind of interaction with healthcare. When did things start to shift? Because I mean, prednisolone is quite a strong anti-inflammatory. It's obviously generally it's prescribed for quite serious illnesses. So when did things start to shift? What led you to being prescribed? You mentioned hair loss. Could you take us through that?
Yeah, at that point I had been experiencing hair loss for about a year. And I, at this appointment, then the dermatologist said that, okay, there's this one thing we could try. And that was pretty much it. It was the end of the appointment, and he handed over me the prescription. And there was no discussion at all what steroids are or what risks they carry. It was just handed over the piece of paper. He mentioned I should not quit the course, that I have to finish the course, and didn't even properly explain that I could have adrenal insufficiency from being on steroids. Also, probably one reason I would not want to opt for them if I had understood properly that risk also.
Yeah, it really sounds like they didn't explain the sort of real side effects that could happen from prednisolone. What was your treatment like? The dosage, duration, and how did you feel while you were on them?
The dosage was 40 milligrams, or starting with 40 milligrams, then reducing by 10 every 2 weeks. So 2 months altogether. I was also simultaneously on clobetasol liquid on scalp which is also a steroid. So it was actually like I was being on 2 steroids at the same time. And that even though it's topical, it also absorbs to bloodstream and also has some, or has a possibility of having some systemic effects. And neither of the doctors who prescribed me this, it was another dermatologist who prescribed me clopidogrel, neither warned about any of the effects. They didn't explain any of the risks, or they didn't, or it wasn't discussed at the appointment at all whether it's a reasonable risk to take, and especially considering that steroids are actually not very effective in treating hair loss even. But I have to say that I did read the leaflet that comes with the bottle. So that was just about it that I knew about the steroids, because I had never taken any kind of steroids before that. So I didn't know to be afraid. But the leaflet, as we all know, it's very brief and vague, and it even doesn't kind of like begin to describe what kind of substance glucocorticoids really are, what they do on a cellular level or gene level, etc., etc. They have just such far-reaching consequences that the piece of paper doesn't, like I said, doesn't even begin to describe what kind of risks you're taking with it.
Yeah, for sure. I mean, that's quite I guess in medical terms, they'd still say it's like a short to medium course dose, but that's a lot of prednisolone, 2 months at around 40 milligrams tapering, plus the clobesterol as well, which is, I think that's one of the strongest like topical creams you can get, right? So you were kind of double hit at the same time. At what point did you start noticing like changes in your body and your mind, like while you were on the course?
About 1 week, it was okay. That I didn't notice much, but after that, it was really like being hit by one side effect after another. It was all in all just very different from anything I had ever taken before, like as in terms of medications. And there was every day it seemed like there was something new happening to my body. I have a list here of some of the acute side effects I had while on steroids. Well, first of all, then my hair started coming off like just like dry leaves. It just fell off. But at the same time, I had hair growth in weird places, like back of my hands and back. I had literally like a beard growing. I had like ulcers developing. I had constipation for days. I had a couple of times I had something that felt like I was having a heart attack at the middle of the night. There was lightheadedness on certain days that was closer to the end, towards the course. Now I know it's also because of the adrenal suppression. My muscles turned to jelly. I developed a moon phase, which is like where your fat redistribution makes your face really round. In the beginning, there was this very like euphoric episode of a couple of days, but that was followed by almost psychotic episode where I felt as if all my emotions were like sucked away. And interestingly enough, I've heard from other people who've taken steroids, prednisolone, that they've described this exact same feeling of emotions being sucked away. So it was a really wide variety of side effects that it made it especially scary, because I had no understanding that it could cause all this, and how can one substance cause like so many things. After researching, I now know why it does that, but at that time it was rather just causing like fear and panic.
Yeah, especially when you're not told that this could happen as well. You don't imagine it could kind of happen to you, but generally with these sort of higher end doses, a lot of things happen at the same time. I was definitely in the same space as you. When when I was coming off my course. I definitely got hit mentally and physically, so it really resonates. You were tapered, and I guess tapering is something I've seen a lot of people struggle with. How did stopping steroids affect you, again, physically and emotionally?
Well, actually, that was, even though the side effects during the course were kind of overwhelming, then the worst was really to just become when I came off. I was like so anxiously waiting to return back to myself, but instead my entire body started to collapse. And I now understand that it's many of those symptoms that I was then experiencing are part of post-steroid withdrawal syndrome, which is results from HPA, hypothalamus pituitary adrenal axis suppression, collagen synthesis suppression, and collagen breakdown. There are cell death processes going in your body, and there are like possibly like steroids are capable of altering gene transcription. So there are a variety of things happening and mechanisms at work that are causing things in your body. But again, I have a bit of a list because there were so many things. The first thing that strangely was that I was noticing that my eyes didn't look my eyes anymore. They were bulging, and my lids had like fallen down, like it's called ptosis. My entire face shape had changed in a weird way that wasn't only about the moon phase. The facial structure had altered. My skin started to like collapse on a daily basis almost, so that each week I was hoping that the situation would be like it was the previous week, because it was so rapid, so fast, how it was collapsing. I tend to call it as being in some sort of a horror sci-fi. That's how it felt. My muscles were really weak, and my thighs and glutes shrank literally. There was extreme fatigue. I had never experienced something like that before, and dizziness I had experienced never before or after. My posture shrank, caused my head to tilt forward, and shoulders like also like coming forward. I know now that that's partly because of the early osteoporosis that it caused me. My knees started to make this like breaking, grinding noise, and that was getting like worse also by each month. My hips were hurting. One that was really traumatizing for me personally was that my skin became detached from its base everywhere in my body, and it remains like that, or most of these side effects have remained. Also, all my tissues became really mushy, and the tone was gone for example, from my muscles. I even developed flat feet in a matter of just few weeks, couple of weeks, because of loss of collagen. It caused me blurry vision, strabismus, which is like disalignment of your eyes. There was constant edema, swelling in my legs, which eventually developed into like lipedema type condition, which is like a fat cell disorder. My teeth started caving in, and became twisted and yellow. My skull seemed to shrink, and jawline eroded, just like just so many things from head to toes were like collapsing in front of my eyes. Very, very accelerated, rapid aging, or like degeneration of my degradation of my entire body. I I provided some pictures that show the rapid change. So
Yeah,
you can maybe
I think we should show those as well. And yeah, that's just a testament to how steroids like systemically touch every part of the body. It's almost unbelievable. And just because my story's sort of similar to yours, and I noticed a lot of rapid changes, you can understand. But it's almost unbelievable the amount of things that happen
yeah.
in such a short space of time. And
Yeah,
I
I
think
think
that's,
it would normally take decades, probably 10,
yeah,
20 years, 30 sometimes, and it's
yeah.
happening in a few months just.
And you hear this a lot. I hear this a lot. People just saying that they just don't recognize themselves, and it is such a profound change. But let's show these photos, and maybe you can talk through them.
Okay, so here I am before steroids, a couple of months before steroids, and here about a week before starting the course. These are also just days before starting the course. Here I'm towards the end of the course with the moon phase I mentioned, and here you can see when I'm starting. I came off, and I'm starting to age really rapidly. It's causing bone loss and soft tissue atrophy, and like eventually, I think I ended up looking almost like mother of the person I had been before. It was when you see the change, I think it's easy to understand how traumatizing that is to see something like that happen in such a short time. Those last two pictures, they were just 6 months apart. Like to lose yourself so rapidly. I think our like human psyche is not even like equipped to handle something like that.
Yeah,
And then at the same time, there you are seeing doctors who are not explaining or acknowledging any of it. Um, I the change I think would be more acceptable to me if it had been part of a life-saving treatment, for example, part of cancer treatment for which prednisolone is sometimes prescribed for. But in my case, it was just very, very unnecessary, and left me feeling like mutilated, to be honest, mutilated and castrated. And like I said, I haven't, a lot of the damage remains. I haven't recovered that much. And yeah.
yeah. I mean, the change is really noticeable, and for people to kind of disregard that, it's undeniable. Yeah, I thought we could maybe get into just some of your reflections on healthcare and pharma, because you mentioned like doctors quite a bit, and it'd be good to really understand like your experience with like healthcare as you're navigating these side effects, because they are pretty drastic. It's like you went in for hair loss, you've taken a drug that's caused you more hair loss, plus a number of other issues that have all happened at the same time. So I thought it might be good just to dive into that a bit. How do you feel about the way doctors have handled this situation? Do they now acknowledge any of the risks that you were put under? Have you been just acknowledged around having side effects from prednisolone?
Um, Short answer would be no. I feel like I had I was left and have been left completely alone. At first, I was running quite frantically at various doctors. Saw like one after another when the previous one didn't say anything. Uh, uh, to get help, I had this innocent idea that when a treatment a doctor prescribes me causes me this kind of damage and this kind of side effects, then the doctors are going to help me. But instead, I was just met with this kind of a silent wall. Um, I They gave me some weak smiles or blank stares, and that was it. And there I was, this patient who's really panicking. Um, like unexplainable things are happening all over to her body, but I was just sent home without acknowledging, without explanations, even though the symptoms I was presenting were very textbook symptoms of high dose steroid side effects. And afterwards, after researching into steroids and understanding the mechanisms, I now understand that the doctors, they must have known or understood the connection between the between my symptoms and the steroid course treatment I had taken, but they chose to let me be in that distress and panic about my health. And afterwards, I think that was actually a very cruel thing to do. I said that they must have known that there was a connection. Let's assume that they didn't know the connection, but that would be just equally terrifying, that they would not understand the connection, that they would be prescribing something like that, or they have a right to prescribe medication like that without understanding what it had caused.
Yeah, my understanding is in the UK, I'm not sure what it's like in Finland, but most GPs and healthcare practitioners can prescribe prednisolone. And I know from our experiences, I think we understand that knowledge is just different across different healthcare providers, whether it's a lack of knowledge or guidelines. But I think to go through this and then be dismissed at the same time, it adds to that trauma that you're going through, right? A lot of things are happening to your body at the same time. You're changing rapidly. You don't know what's going on. And then you're being told by your healthcare provider that there's nothing, it's not related to steroids. What types of practitioners did you see? So you saw a dermatologist originally. Like when you were then trying to understand side effects, what other types of doctors did you see?
Well, I saw several dermatologists, and I saw neurologists, but a lot of these were referrals from my GP, neurologist, um, um, now I'm trying to find where's physiatrist, which is a bone and muscle disease doctor, so not a physiotherapist, but physiatrist. Just a lot of specialties, and some specialties, several representatives of that specialty. I have to say that I've never seen so many doctors in my entire life that I have during these 2.5 years after steroids, and maybe especially the first 1 or 2 years. Lately, I've become to understand that there's not much they can do, but there are still things that concern me because the steroids, they do cause things that can start to materialize like much later. For example, avascular necrosis, which is bone death. So it can start with a considerable lag since you stop steroids. So there are still a lot of unresolved issues, and like a lot of symptoms still developing that are probably direct consequences of that course.
Yeah, I think a lot of people imagine that when you come off the pills that everything just resets itself, but I think it sets things in motion as well, which we found. And what you said about never seeing so many doctors, that resonates with me so much. I've never really seen doctors much my whole life, and then suddenly I'm seeing 5 or 6 different specialities and having lots of different blood tests. And yet a lot of the damage from steroids early on just tends not to show. Just in general then, so did you feel it was more of a fight to get them to listen to you as opposed to them being supportive? Like you obviously knew a lot of this was directly related to the course of steroids. So do you feel like you were having to make them understand?
Yeah, well, it was a fight, most definitely, and that's kind of sad, that it was fight. I was met with so much gaslighting. I have never met so much gaslighting in my entire life, from doctors or from anywhere. And it kind of puzzles me that why does it come to that? But anyway, so um, I was met with gaslighting arguments. So that led to me reading and researching. And so I just, after each visit, I would just prepare myself more, read more articles, and prepare my case. After a year and a half, approximately a year and a half, I have read that much, that I started to really realize what steroids do on hormonally in our that HPA axis I mentioned, hormonally, genetically, and with about the collagen suppression, etc., etc. And that was a real light bulb moment for me. Everything started to make sense. Why I'm having all these symptoms from head to toes. Collagen breakdown, for example, it explains things starting from eyes to the feet that I mentioned. So and everything in between, skin and muscles and bones and etc. etc. So, but I think that burden should not have been on me, and but it was, and I've been wondering about that. And I think there seems to be a lot of protectionism when it comes to steroids among the doctors. They seem to be defending a substance that they find very valuable. They find a valuable tool for their work. And I understand it for, like, we often talk about, like, it's important, it has its place, but it should be reserved to very life-saving situations or similar. But there's also clearly, during this process, I've learned there's clearly also a very strong culture of protectionism among doctors to protect another colleague, and they don't criticize other colleagues, other doctors' treatment decisions. And I think that protectionism comes at the expense of patients' health and should not be like that. But there's also simply not enough information, that doctors' knowledge about steroids is often very superficial, very limited, sometimes outdated. And the concept of a long and short course, for example, then they don't often even understand what a long course means in the world of steroids. So it doesn't necessarily mean being on years. If you have a high dose, then courses above more than 2 to 4 weeks are considered long courses. So, and finally, a long answer, but I feel that they don't really understand this, like the far-reaching consequences steroids can have, because they destroy collagen and affect genes, etc. So those are not very reversible always, and they seem to downplay the distress that the patients feel about steroid treatment. I think you mentioned about a study that shows this, that that they downplay the distress that patients feel.
Yeah, there's almost that wake-up moment as well when you start looking into it, and it starts making sense very quickly as to what has been in your body. These are powerful anti-inflammatories. I feel like they're used in a broad way, and they have a use if you have something acute, but the changes to the body are so profound and systemic. I think one of the studies mentioned, it's 3,000 to 6,000 genomic changes in the body. That's 16 to 20% of your body is being changed by a drug. And the clinical studies, really, in humans, they haven't gone into complete depth as well. So there's a lack of understanding clinically, and then I guess that then goes down to the healthcare practitioners who, in some cases, are just not up to date on what they do. And it's very paradoxical as a medication. It reduces inflammation, but it also causes a lot of breakdown of the body. I really feel they should name it what it is, like a catabolic, system breaking drug. Like it does so much damage alongside, the apoptosis of the immune system as well, which is what they want. Really, they want to reduce inflammation, but at what cost? So yeah, that wake up moment. It's like you didn't want to be alerted to this. Like in my case, I've never researched drugs before, but once you find out what you've taken, you then start looking into it. So that, yeah, again, that resonates so much.
Do you,
I guess I
do
know
you
the
mind
answer
if
to.
we take a pause?
Yeah, sure. Let's do that now. So, what's your perspective on the pharmaceutical industry now? Do you think steroids are overprescribed? I know you had it for a dermatological reason, but yeah, what's your perception?
Well, most definitely overprescribed. In my opinion, they should really be left for life-saving situations only, or just extremely debilitating health conditions. If not restricted and still prescribed for example, cosmetical issues, for hair loss, acne, something like that, then I do believe that there must be transparency. There must be honesty about their side effects, and there must be accountability. When people encounter these side effects, they cannot just be swiped, or they cannot just look away. But the transparency and honesty uh, are the most crucial, so that every patient has a chance to make an informed decision about what kind of risks they are willing to take on their bodies, and that's a right every patient should have.
Yeah, I'm with you on informed consent. I think it's really important. And it probably should be standardized in a way. Just as I say, many of these healthcare practitioners just don't know the full extent of what they can do. And it's like, tell me what it can do. Tell me the worst thing so I can make a decision and actually have an informed choice. Because as you were saying, your doctor mentioned insomnia maybe as one of the only side effects, or didn't mention much, but you've had a breakdown of your whole body, and I'm sure there's many things on that list that if you had known could be a possibility, might have like changed your choice. So I'm with you on informed consent. I think it's really important. Yeah, it's not about taking away a drug. I do also feel we could handle the reporting of side effects better. As you mentioned, it was a bit of a fight to get acknowledged. And with me also, it's very hard to get them to acknowledge that these are steroid side effects. But when you come from a fairly healthy standpoint, you know the changes, right? You feel
Yeah,
those, and
yeah,
they're so profound. So I feel just being able to alert the side effects, especially on short courses as well, because it's not just length, it's dose, and it's something that's never been mentioned in my appointments. Dose, they always say, well, it was a short course, but they never talk about the dose that I was on.
yeah.
Um, so look, Villeinia, if you could go back, knowing what you know now, would you have done anything differently? I think I know the answer to this one, but I want to ask you anyway. What would you have done differently?
Well, I would have never touched them. I would have never touched them even with a long stick, to be honest. Um, if I had known that they might age you, um, even if not this drastically, but just let's say 5 years or something, I would have never opted for that. Or even knowing that how prednisolone causes fat redistribution in your body, which is very unflattering and very difficult to lose. That would have been definite no. My body was important to me. It was fit and healthy. Um, and how it affects hormonal disruption, I always kind of knew to be aware of any hormonal medications, but I didn't even understand that as cortisone, as it's called in my country, is a hormone. When you don't, when you uh, haven't had or haven't been prescribed it for anything and haven't had any contact with it. So cortisone just sounds like antibiotics, cortisones, one of those medications. I had no idea it's a hormonal medication, which I would have also not ever touched if I understood that part. Or just knowing that it causes osteoporosis, for example. Who wants osteoporosis, like early osteoporosis? No one. So I would have never ever gambled on my entire body just to get a bit more hair, and I practically gave my entire body in exchange for something like very unlikely outcome, actually.
Yeah, you don't imagine walking into that office that you're going to be literally poisoned with something. That's how it feels.
Yeah.
And it is a drug; it has a use, but in your case, hair loss, it hasn't even resolved the issue, and
Mhm.
you're suffering with just a breakdown with some lifelong changes. So, yeah, not many of these stories are heard, or people can relate back to the cause of things. They normally relate it back to the initial reason that they went in the first place. But I guess when you're relatively healthy and you have a good life and you're not seeing doctors and you take something like this, you notice. And I think a lot of it, I think because they don't encounter this and because people are not self-aware, it's why they're in disbelief. One of the hardest parts of this journey that I found is how it affects the relationship with yourself and others. Could you talk about just how this has affected things like relationships with families and friends or work?
Well, it's taken a toll, huge toll, I would say. The thing is that it's not as much as how other people necessarily see me, but like your world has collapsed, your life has collapsed, your body has collapsed in very unimaginable way. There's, I would say this is one of those things that is like life before and life after. For me, I see it as like the person I was has died, and other people who have not gone through something like that, they just simply cannot understand. This is not talked about. So people often just look at you and think like, well, we all age. And to me, that is luxury that I don't have now. I don't get to age in the safety of my body. Instead, I have this chemically poisoned or chemically altered body, and on top of this, of course I'm going to have biological aging as well. But even though prednisone, many of the things it does, it resembles outcomes of aging. The fact is that it's chemically induced, and it's traumatizing and feels very violent. In the beginning, I think that I wanted my friends to understand, friends and family to understand what I was going through. But then later on, you realize that, well, it would be nice if they did, but you don't really need their validation to feel pain and grief for the loss, for your loss, which is loss of yourself. I also felt that I've had to limit, because of this, I've had to limit some contacts just to protect myself, and protect my space to heal. But all in all, I think this has just made me, compared to what I was, then this has made me like much more recluse, isolated. But not only because I wanted to protect myself from certain communications or certain certain relationships or situations. I think this has also changed who I am, like very profoundly. You go through something that it's so life-changing that it does have effects of the person who you are, whether you want it or not.
Yeah, you mentioned it's changed, like who you are. Like, how do you see yourself now, and how have you got through those tough times? Because you're still here today. Like, what's got you through?
Yeah, I I have felt like such isolation that, like most of the time, that I I would describe it as like chillingly lonely place, loneliest ever I felt. Because, like I mentioned, then there are friends and family who cannot understand. There are doctors who are not acknowledging or helping you. So you're left very alone in a situation where your body is collapsing from head to toes, and changing your appearance in frightening ways. It's, again, I mentioned, like, you're left alone in that horror sci-fi. It's almost like an alien has invaded your body, alien that looks uh, strange and feels strange and doesn't feel safe. So a lot of times it's just been just breathing through to the next moment, so that it's been more like surviving than living sometimes. My son has kept me here and or kept me fighting, I would say. But I do understand that a lot of people who have gone through something like this have had suicidal thoughts, and I fully understand that. Um, but support groups help, because you realize that you're not the only one. You're not that rare case as the doctors are making it be. So all that helps a bit.
Yeah, I think understanding that it's not in your head and having some validation to this is really important. And it's one of the reasons why we're doing this episode today, just to raise some awareness on it. If someone was just starting prednisolone today, I guess for something similar to what you were prescribed for, what's one thing that you wish they knew?
I wish they knew and understood that they can lose their entire body and ask themselves whether it's worth it. They can age 10 to 20 years, whether it's worth it. Are they willing to risk something like that? And also understand that it's not necessarily even very remote likelihood, but actually can be likely that it's going to happen. So so you can, if it's like some cosmetic reason, then clearer skin or something, then in exchange you may lose everything what you have.
Yeah. I mean, you mentioned it's a lonely place, and it's almost like what adds to the loneliness, I think, is you almost get complete diseases in itself after this, like osteoporosis and issues with like the connective tissue in your body. There's so many things, and it's almost like no one's aware of these. So, and sometimes they're not as visual, so it can be quite a lonely place. And I think you have to be mindful that this is a possibility if you're taking something as powerful as this, something that isn't like life-threatening. If you could go back and talk to your pre-steroid self, what would you say?
Well, most definitely I would just say, like, don't touch it. I often think that if I had a chance to go back in time and never open that bottle of pills, if I was given that chance in exchange of having 5 years left of my life in the body I had pre-steroids, then I would take that trade-off or deal. Also, I want to again highlight that the hair loss that I had, even though it caused me anxiety, then it was something that like happened in me, whereas this was done to me. So this has a very violent dimension about it that causes an extra layer of trauma, I would say. I think we talked about this once, and I mentioned something about people getting hit by drunk drivers, and you said that, yeah, but these drivers were not even drunk, and I think that's very descriptive of the situation. yeah, it was negligence. These drivers were not even drunk. They just decided to leave out crucial information, and in that sense, like murdered the souls that we were.
Yeah, and it sounds dramatic, but it is chemically induced kind of murder in a way. Like the body's changed so much, and so many things have now developed because of something that is quite unnatural to have this many changes in the body. So I think it's very akin, and yeah, as we discussed, if they're not acknowledging it as well, because we know science isn't always right and it's evolving all the time. And I think just right now there's a lack of understanding, but I do imagine they'll look back in 5 or 10 years at these drugs and just be like, wow, they were quite broad spectrum. And it was what was it we said? A nuclear bomb to kill maybe an ant in a way. I think that describes it in the best way. It literally.
Yeah, it does. And I mentioned like.
Yeah. So obviously there's been some profound changes with you. How has this affected your identity and how you see yourself and your sense of who you are right now?
Well, to me, the woman I was has literally died, and I will always have this grief about the loss, and it does pain me to see, like, for example, some of her shoes and clothes, etc., that belong to that woman, and I do have fear of this body that doesn't feel safe because it's not mine. You can imagine maybe like being in a fire and losing your face or part of your face, and being in an accident and losing parts of your body, or so that your body doesn't feel same. Because our appearance and our body, they are cornerstones of like who we are, how we see ourselves, and how we relate to the world. And then not being able to recognize yourself, then that causes like just huge terror. For me personally, it's been so traumatizing that I was initially on a sick leave for 10 months, and since then I've only been able to return to work for 50%. I believe that I have to build like my identity anew, like build me anew. I don't know how, but it's obviously a process, but requires to create new memories, etc., for this person who I am now. There's also a lot of shame in having your appearance altered this much, but at the same time, I want to give credit to this woman who has survived something that would have broken anybody.
Yeah, you've got to give yourself a lot of credit for going through this. It can be hard to do that sometimes as well. You don't realize the progress and what you've been through until you start reflecting on it. But yeah, it's really important. In terms of recovery, have you found anything that's helped in recovery? Supplements, therapies, anything that's made a real difference in this journey? Because you've, yeah, it's been a while since you've been off the course. So could you talk about anything that you've discovered?
I think the best help that I've received has been from integrative medicine. And focusing on things that help in cell renewal, collagen synthesis recovery, connective tissue repair, things like that, which are often just rather basics about exercise, good nutrition, certain supplements, rest. So really no magic cure there. But the mainstream doctors I've seen or noticed have not been able to be of much of help because they focus mostly on individual symptoms and are not seeing this as a whole. So sometimes because of this lack of understanding and treating just one symptom, I feel that some things may have made things worse for me actually, because I've been prescribed something that doesn't make sense in this entire context, for example, HPA axis recovery or something like that.
Yeah, that's an important thing around mainstream medicine versus integrative or functional doctors, and that's sort of looking at the individual parts versus looking at the body as a
Yeah.
whole. I came to the conclusion very quickly that there's probably not much they can do for me until I need to be on an operating table for something. But yeah, I think you almost have to go back to the basics, right? Like moving, sun, good food and nutrition. Even if the body doesn't respond how it normally does, it's the only thing we can kind of do. What keeps you going on those tough days?
I think I mentioned my son. I think if I haven't, then I want to mention now. Nature has given me. I haven't been much of a nature person before, but I realize now that like nature embodies a lot of. Well, in general, I think like the miracle of life, how nature manifests it, like moving water or leaves rustling, etc., etc., seasons changing. That has given me, like, for some reason, that has given me comfort. Dancing personally been important part of my like staying afloat, but at the same time, like I mentioned, there's a lot of shame of this change and of this body and this appearance. Then I sometimes struggle to go. Support groups I mentioned earlier also, they have been important. And also just, I think life makes you accept things that you first find unacceptable and impossible to accept. There's just kind of no other way. And then I guess trying to hope that there can be some kind of recovery. But at the same time, this has meant that I've had to give up a lot of hopes and dreams that I had, and now I have like this body and this life, and believing in that there's still some function in this universe for me in this version.
Yeah, definitely. What are some of the biggest lessons that you've taken away from this whole experience then?
First, I think I've realized that medications treat symptoms. They rarely treat the root cause. And while treating symptoms, they often cause side effects elsewhere in the body. And those side effects that are mentioned in the leaflets of the papers, they actually can materialize. So medications should never be taken lightly or prescribed lightly, or without discussing risks. Also, I realized that doctors, they have very limited knowledge, which is kind of inevitable, really, because a human body is so complex, and science of medicine has only been able to like touch the tiny surface of how human bodies work and of all the interactions the bodies carry or have. So doctors sometimes, I think, in arrogance, certain kind of arrogance, pretend to know everything, which they cannot. So I would wish them to be a bit more humble. But personally, I'm not trusting doctors very blindly anymore. But on a more existential level, I guess, then this has taught me that quality of life matters more than quantity of life. And somehow in this process, I think differently of death, and I don't have fear of death anymore, I guess, or same fear of death anymore. Also, I see the role of suffering differently in human experience. It is there to like really teach us something valuable, like true basics of life. And yeah, the one thing that I like is about mention is that that this has taught that we cannot argue with life because it never going to end well. Life does what it does, and we are there in a way, in a way of life, and things happen to us, and we can argue as much as we want, but there's really no point.
Yeah, I think there's some really powerful lessons. And you mentioned innocence earlier, and then blindly trusting, and it's like we are quite innocent if you haven't had interactions with healthcare, and it's only until you're on the other side that you start to kind of realize the state of healthcare as well, and what could happen. So yeah, that certainly resonates with me. And then the arguing with life, yeah, you soon realize that you can't, and that living in hope as opposed to fear. And it's a long journey for some people, because again, it can have such a profound effect on the body. And me and you are hearing these stories every day on the group that we're on, the group that we run. So finally, for anyone out there struggling with this, how can communities like the SSD Systemic Steroid Group, or YouTube channels like this, how can they help people?
They do provide very valuable validation and also knowledge, because doctors are not providing either, I think. So you realize that you're not alone, and there are people who know what you're going through. They have experienced it. They know what you're saying. They know it. They experienced it, everything. So every bit of it. So it's just, I would say, very validating because this is not, like I mentioned earlier, this is not something that people know about. So you probably don't have many people near you, or your near ones haven't heard of something like this, whereas they might know of some other diseases and illnesses and can relate. So the loneliness of this journey can be devastating and chilling. So support groups play an important role there.
Yeah, I completely agree. I think validation is so important, especially if you are being gaslit by doctors, even family or friends, right? You need to know that this is actually something that's real and can happen. Otherwise, you'd be convinced that it's all in your head. Villeinia, I just want to thank you for sharing your story today. This is why we do this, just to make sure that these conversations happen and they're open. So if you're listening and you have a story to share, or you just need support, then we have a Facebook group, which I'll link in the description of the video, and it's where we just connect with others going through this journey. Yeah, and don't forget to subscribe so you don't miss the next episode of the Steroid Diaries. But thank you very much, Villeinia.
Thank you.